All right, so now we're going to talk about post-term birth. Post-term is delivery after 42 weeks of completed gestation. Misdiagnosis used to be really common because dates were inaccurate, but now it's a lot, dates are a lot more accurate. So if we see this now, it's more likely to be real. The people who are most likely to go past their due date are having a first baby, or if they've ever had a late baby before. Okay. What are the risks? If someone is past their due date, there's usually a reason for that. And sometimes it's that the fetus can't move down enough to really trigger the onset of labor. So it's more common with a larger baby. But also that longer time can give the baby longer to grow. Okay. It can cause dysfunctional labor, so the contractions don't work effectively to dilate the cervix. The risk of infection increases, the risk of postpartum hemorrhage increases, the risk of perineal trauma increases. So they're more likely to have damage to the perineum because of that baby that may have had longer to grow. The risk of being induced and having a C-section increase. Also, they're dealing with the discomforts of pregnancy longer and the mental, emotional stress of when is this baby ever going to come. The baby can continue to get larger, but also the baby can lose brown fat, subcutaneous fat, and even muscle mass because the placenta ages. And so it starts to provide for the fetus less effectively. And so the fetus may actually start to use the brown fat and cutaneous fat that are there to provide for thermoregulation after birth, and even some muscle mass. The placenta, we just talked about placental insufficiency. Now, if the placenta is not adequately perfusing, then that means the kidneys are not perfusing as well. So there's less fetal urine, so there's less amniotic fluid. So oligohydramnios can happen. If we have oligohydramnios, then we may actually end up with cord compression. So that's another issue. And if the fetus is not being perfused adequately, if the placenta is not perfusing, so the fetus is not getting adequate oxygenation, that can cause the sphincter to relax and they pass meconium in the amniotic fluid. But also just going past dates can increase the likelihood of that meconium aspiration or meconium staining. If there's meconium in the fluid at birth, the fetus can aspirate it, and there's a specific type of pneumonia that's caused by that. We're going to talk about that with newborn care. Just for this, you need to know that that's one of the potential risks. The complications that you can see maybe from the post-term pregnancy, just the pregnancy going longer, the placenta ages, the baby keeps growing, but also they can be from some of the interventions, because at some point, the risk of intrauterine fetal demise goes up. So the complications can either be from the post-dates pregnancy itself or from the interventions, because once at 42 weeks is when the rate of or the risk of intrauterine fetal death goes way up, but it gradually increases from like 39 or 40 weeks up through 42. Most providers are not waiting till 42 weeks to try to get the baby delivered. They're going to try to induce sooner than that. And we know that induction and C-section carry some additional risk. So some of the risk is from the interventions, from trying to get the baby out to avoid other interventions. Management for this, if the patient is post-dates, they need to be delivered. So the provider will be doing something to deliver them. We need to encourage that patient to monitor fetal movement every day and notify someone if there's a change. They need to get BPPs and NSTs until they can get to delivery. And then they need to be observed really closely while in labor, because with an aging placenta, the fetus is more likely to not tolerate labor well. Okay, next section is going to be about dysfunctional labor patterns.